Good evening. My name is Chinyere Awamba Ago. I'm presenting an evidence base on effectiveness of enhanced cognitive therapy in management of eating disorders. Disclaimer. Evidence presented in these slides is a collective analysis, synthesis, and translation of 6 evidence-based study articles gathered from my previous annotated bibliography on the effectiveness of enhanced cognitive therapy in management of eating disorder. Introduction. Eating disorders affect all ages, but more serious among the adolescent population. It is a major psychiatric disorder that involves individuals losing thoughts of food and their eating pattern. Eating disorder, if not treated, may lead to chronic and incapacitating condition, affects the major organs, resulting to development of comorbidities and increased mortality rates. 3 types of eating disorders include anorexia nervosa, bulimia nervosa, and the binge eating disorder. Proposed change. Enhanced cognitive behavioral therapy, CBT E, is one of the evidence-based adopted psychological management for eating disorders. Use of CBT in management of adolescents with eating disorders will help them to recognize their eating disorders and make necessary changes needed to improve their health. I am proposing CBT to be adopted and to be implemented by all clinicians in their different area of practices for the management of adolescents with eating disorders. Literature review. Atwood et al. 2020 used systemic review method to examine 20 articles to determine the significance and efficacy of enhanced cognitive behavioral therapy for adults and older adolescents with eating disorders. The 20 articles selected by the reviewer include 10 randomized controlled trials and 10 uncontrolled trials that were in compliance with the recommended guidelines. The study participants in these articles met diagnostic standard for anorexia nervosa, bulimia nervosa, binge eating disorder not otherwise specified, or other specified eating or feeding or eating disorders, according to the DSM-5 in APA 2013. It was concluded that the use of CBT was effective in treating range of eating disorders as evidenced by reduction in eating disorder behavior and increase in body mass index. Atwood and Friedman, 2020. Literature review number 2. The author conducted a systemic review to assess the treatment outcome of CBT-E in treatment of anorexia nervosa. The total number of 15 CBT-E studies carried out on 948 human participants were reviewed. The Ham, Grave, and Hodgson, 2019. The study assessed the effectiveness of the use of CBT-E as a treatment option for all EDs using binge and the purging episodes. After the outcome analysis using BMI and the follow-up results, the change noted from the BMI suggested that use of CBT-E has positive effect in treating eating disorders, as noted by the Hamburg, Graves, and Hutchinson, 2019. Literature review continue. The study examined the usefulness of enhanced cognitive behavioral therapy, CBT-E, in management of eating disorder and its complications in the clinical setting. It concludes that CBT-E is more effective when used for shorter treatment than in longer periods. The study utilized a multicenter randomized controlled trial, which was carried out at the 3 specialized eating disorder treatment centers in 3 different regions in the Netherlands, with 143 adult patients diagnosed with eating disorder, BMI range 17.5 to 20, 20 to 25, 25 to 30, and 30 to 40. The study randomized participants in 2 different groups. The study compared the focused version of CBT-E with treatment as usual, TAU, for patients with an ED and BMI greater than 17.5, and the difference in recovering from the ED and the decline of vital aspects of ED, psychopathology, and the comorbidity symptoms of anxiety and depression. The study outcome suggested that enhanced cognitive behavioral therapy was most effective at the first 6 weeks of the treatment, and the participants who received CBT-E showed a large decrease in ED psychopathology, according to Jung et al. 2020. Literature review continue. Lenardon, Mesa, and the Fuller, 2018, reviewed the meta-analysis of randomized studies on cognitive behavioral therapy for eating disorder, binge eating. The study outcome of this established that across all range of eating disorder subtypes, the general weighted abstinence was estimated to 42.1%, in parentheses 95% CL, and 34.7, 50.1 for those who completed CBT. Evidence shown that 42% of individual completers achieved abstinence with treatment of CBT in the routine clinical practice, while follow-up estimated were 47.3% and 43.8%, which established that CBT management in routine practice produced a lasting effect. The outcome of the study proved that success and the practicality of CBT for eating disorders, particularly binge eating type disorder, can be sufficiently managed in real-world setting. London, Mason and the Fuller, 2018. Literature review continued. In this article, Pelzer, Waller, and Wade, 2019, utilized 10-section cognitive behavioral therapy to evaluate the effectiveness on non-underweight patients. Sample comprises of 35 participants, age greater than 16 years, and with body mass index greater than 17.5 in an outpatient clinic for CBT treatment. The results were maintained after a 3-month follow-up. Outcome from the findings showed that CBT as an effective treatment for non-underweight eating disorder clients. This study does not require long-term follow-up period, but may be required to evaluate the credibility of the results. Literature review continued. According to a randomized controlled trial conducted by Wade, Bryan, and Allen, 2017, the article proved that CBT E is an effective treatment for eating disorder in a group setting. The study sample were made up of patients with eating disorders, which include 40 females between the age 18 and 36 years, who were randomly selected to immediate start or delayed start group treatment. The outcome established there is solid evidence showing the efficacy of enhanced cognitive therapy for individuals with eating disorder, even with group therapy. Implication for practice. Eating disorder is a major psychiatric health issue affecting all ages, but very rampant in adolescents. It is very important that healthcare providers, especially psychiatric mental health nurse practitioners, should implement the DSM-5 guidelines in assessing, diagnosing, and treating individuals with eating disorders. Early diagnosis and initiation of appropriate treatment guidelines is crucial in treatment of individuals with eating disorders. The mental health nurse practitioners should engage in use of comprehensive treatment plan for eating disorders, including hospitalization when needed. The 6 reviewed articles established that strong evidence exists that enhanced cognitive behavioral therapy is effective in psychological treatment for a range of eating disorders. These are my references. These are my references. Thank you.